Hi everyone, my name's Rachel,
I'm Maggie.
And I'm Danny.
and we're going to be talking about situational leadership.
Alrighty, so situational leadership is a breakdown of a situation into steps to analyze before acting upon it. So it's a very adaptable form of leadership that really looks at a person's need and whether they need more direction and support based on those individualized needs. So it's a framework to use to look at each step and situation and examine how to direct the flow and interactions between the leaders and the followers. So depending on whether someone needs more guidance and direction, or whether someone needs more like a socio-emotional support, things like that to really make sure everyone's ready to perform the task. So, like I said before, it starts with breaking down the task. So, what does the person bring to the task? What are their skills? What are their experiences? And what kind of knowledge do they have? Also, you have to think about, is the person motivated to do the task? Do they feel confident with doing it? So it really looks at what drives behavior changes and matching a person, matching the leaders and the followers, and seeing what needs to be changed to best direct the situation. All right, so situational leadership can be broken down into four categories. So there's delegating, participating, selling, and telling. So delegating, which is also known as directing, allows the team to take responsibility for decisions. So it's characterized more about delegating tasks for the workers who can work independently. And then next we have participating, which is also known as supporting. So this really emphasizes sharing ideas and decisions. So an example of this would be leading employees who, although they may be experienced, they may lack some confidence to complete the task. Next, we have selling. So this is also known as coaching. And this is where leadership has to persuade team members who have the ability to do the task, but they may lack some confidence in doing the task. So they may need some extra encouragement. And then lastly, we have telling. And then this is where leadership has to provide explicit direction and supervise work closely. So this is mainly seen with managing new team members.
So some examples of the four categories for situational leadership on this graph would be for telling, could be I need clear instruction and direction, or structure and direction. Selling could be I'm inexperienced but highly motivated, so I need both encouragement and direction. Participating could be I have a good understanding of what I need to do, but I still need support. And then delegating could be I am motivated, competent, and confident.
And so, looking at some strengths and challenges within situational leadership, it kind of includes some benefits which really promote a change in behavior among team members to increase their quality and development towards goals for their team. It also really facilitates the skills that the leader is implementing with this approach to both respond as well as interpret what is being done within their environment to really achieve this beneficial outcome. Also, there is a strength to allow the leader to find common ground to really promote change between team members, and then further into this interactions between that practitioner and the clients that they're seeing. Some areas for growth within situational leadership include that it could cause some confusion if this leader is constantly changing their approach. There are four main approaches within this model, so and the leader really changes throughout all four of those while they're using this model. They might neglect long-term goals since this approach really focuses only on short-term goals. And then it also could create some risk. So if that situation causes the leader to make choices that don't necessarily suit their team or individuals, this could result in a little bit of risk there.
So this slide is the situational models connection to current occupational therapy models. Supports of this style that bridge to current occupational therapy models are seen within the 4 competencies. The 4 core competencies of the situational leadership model all connect directly to the appropriate use of therapeutic modes as a part of the intentional relationship model. So the IRM focuses on relationship building based on meeting the client where they are through specific modes of leadership. So going back to that graph that Danny had shown, it's like meeting the client where they're at in each of the 4 categories. So the 4 competencies we have here listed, number 1 is performance readiness to complete a task, which we thought matched well with empathizing mode. 2, adaptation of leader behaviors, which matches well with a lot of the modes, hence the word adaptation. Number 3 is communicate and influence approach in a manner followers can understand and accept, which matches well with collaboration. And then number 4, we have management towards higher performance, which matches well with the instructing mode. So I think it's easiest to comprehend our inhibitors as like in terms of cons, I guess, for this style. So this can be closely tied to the old medical model. The medical model used to be more focused on a quick and mechanistic approach rather than occupation-based therapy. This can allude to the time-consuming aspect of this style in intense and high productivity settings, such as a hospital. There are also frequent shifts in the model's terminology. This is seen when it was shifted from delegating, participating, selling, and telling to directing, supporting, coaching, and telling.
And now we're going to talk about the application of this theory to clinical practice and client-centered care. So one of the main concepts is flexibility. So there's flexibility in one's leadership approach, which really allows an occupational therapist to be an active leader in the healthcare industry. And this is done with the OT can really evaluate the needs of their clients and individuals on their interprofessional team to meet their learning style. So this approach is very flexible. There is coaching. So the occupational therapist can use this coaching approach to promote the development of skills that are needed to achieve personal goals in therapy and achieve the goals of their team members. Telling is also a great approach. So if you're working with a new team member that reaches out wanting more clear instruction and close supervision, you can use this approach to meet that person's needs. And for directing, you would really divide the work among team members. You can find a time that works best for OT compared to other therapies, and allows for collaboration among professions. And then supporting, so this approach really encourages the occupational therapist to share ideas among their team members and then promote their team members to share their ideas too. This can be during collaboration between healthcare professions, even advocating for the client, such as needing insurance to cover more visits or other different services. And then this approach also allows for the incorporation of universal design. And there's 7 key components of universal design. 2 of them are equitable and flexible. So we talked about the flexibility of this approach earlier, and then equitable applies because this design can be used people with diverse abilities, and this leader can be flexible in their approach to meet everyone's needs. This approach is also simple and intuitive. There's only 4 key core components of it, which makes it easier to recall for the leader to use on an everyday basis. It's perceptible. So this approach really has a visual format that can be used to increase perception of the team, as well as when they're talking to their team members as well. And then there is some tolerance for error. So this model allows the leader to adjust their approach to best suit the team members they're working with. So maybe the approach that they started off with, maybe they started off with coaching rather than telling, and they can adjust their way that they're interacting with their team members to best suit everyone's needs. And so there is that tolerance for error. And then this approach doesn't really talk about low physical effort and then size and space, which are used in universal design, but the therapist can use their clinical reasoning skills rather than this approach to make sure that those needs are being met. And then here are some of our references. We have some on this page, as well as we have one on this page here. Thank you so much for watching our presentation and have a great rest of your day.